All right, chiropractic care for clearer vision. Yes, we're going to do a quick review. We're going to talk about the 3 top exercises from a couple months ago, and then the 3 top foods.
So this is a combination of both those classes?
It's a combination. This is the 3rd of 3.
Oh, there's a 3rd one.
So this is the 3rd one. Quick review. So really important, we talked about the Bates method, and relaxation is really, really important. He was an ophthalmologist back in the late 1800s that prescribed glasses just like everybody else did back then, but then he realized there should have been a better way, because if you worked with the muscles of the eye, you can actually help change the shape of the eyeball, and that will help you determine how you focus. Great success, still a little controversial. So deep breathing is a big part of this. So you sit quietly, you can lay on your back as well. Put your hand on your belly, take a deep breath in through your nose, and the belly should go out. People don't like that nowadays because they think it makes them look fat, but we're trying to be healthy here. And if you're already a little chubby, then it's fine, you can't even notice. So you sit here like this, breathe in, the hand goes out, and then out through the mouth. And you breathe out about twice as long as you breathe in. So if you breathe in for 2, out for 4. And that really helps to superoxygenate the blood, and it uses the lower portions of the lungs to make sure you're using as much of your lung capacity as possible, and that gets more oxygen into the brain, which is always important for health. And one of the neat things here is you can also see the hands up here, they're like this. So as you're breathing in, you have the hands cupped in your lap, and then as you breathe out, you flatten them out, and you visualize your eyeball actually kind of flexing like that. And it's kind of a weird mind-eye connection, but you're breathing in, out, and it's really interesting because it talks a lot about that, the mind's eye, and how you need to connect your vision to your brain, which is always important because the brain is what processes it. Now, palming. Whenever we're out and about looking at computer screens all day long, driving, staring at traffic, just all stressed out, you're usually focused, especially at the computers, you're focused right here. So there's a lot of nearsighted people out there because they can see up close, but far away they can't see anything. So with the palming, this helps to repigment the brain, not the brain, but the eyeballs, because the eyes get bleached. The special cells in there get bleached. The rods and cones, the rods see black and white and the cones see color. And so when you're out in the sun or have bright light from a monitor or from lovely lights like this, it bleaches out those super cells in there, the specialized cells. And so you do the palming to help regenerate that. So you put the right hand up here on your right cheekbone, and you put your fingers across the forehead, left palm on the left cheekbone. You're not pressing on the eyeballs at all. It's just right on the cheekbone. Cross the fingers over in the forehead, and they talk about how this is a really important chakra right here, but I'm not going to go into the chakras right now. But you do this, have your eyes closed. You should have your elbows supported like in the image, and you just take a deep breath in again, out through the mouth. Do that a couple times. Now, if you've been looking at a computer screen for a long period of time, you're going to see like flashes of light. It's not going to be very dark. And you want to make sure that you get to a point where you're focusing on like a black piano, a black cat, really focusing on something really completely, totally dark, because that's going to help regenerate that pigment in there. It's called visual purple is the name of the pigment. So now the counterpart to palming is sunning. And this is what I did. I did this a couple of years ago, probably 2.5, 3 years ago, and I wore glasses since the 8th grade and thought it made me look smart at first. Sorry if I've told you this story before, but there's some new people here in the audience from Saskatchewan, thank you very much. And I wore glasses, thought it made me look smart, and then after a while playing football, I played football for forever it seems like, and wearing glasses or contacts was such a pain because I'm always touching my eyes, and I'd get sweat in my eyes, dirt in my eyes, fingers in my eye, playing football, all kinds of bad stuff. And so after football, I became a chiropractor and realized that there had to be a natural solution to vision problems. I'm like, okay, I know that the current medical model is just drugging all the symptoms, and chiropractic focuses on working with the body and healing the body naturally. So I wonder if there's a way to do that for vision. And that's when I found the Dr. Bates method and was just blown away. So I did this exercise, the sunning. Now, this is how they recommend you do it. You start out, you're looking up at the sun, you have your eyes closed, You're just standing here nice and relaxed, and it's really important to have your arms and upper body stretched out and loosened up, because that, if you have any tension in the neck, that's going to help or cause pressure on the nerves up here, and that's not going to help you see better. So it's all about relaxed and accepting what you do see, because you might not see clearly at first. We're not telling you to, if you see something fuzzy, say it's clear, because that's not true and that's not going to work with your brain. So you can just see, okay, well, that's fuzzy, but I can see a little bit. I can make this out, or I can make this out, and just accept what you do see. Acceptance is really important. So with the sunning, you start out, you have your eyes closed, and you just turn your head to the side and do the deep breathing. Back and forth. And when you do that, even when if the light's in here, you can kind of tell, you can feel when you turn your head to one side, the side facing the light has the light there, and it's a little darker on the opposite side. And especially when you have the sun right here, you can really notice a difference. Plus the warmth of the sun is right there, and this helps to stimulate the circulation, and it also helps to produce vitamin D3, which is always great for the immune system. So it's really important to get out in the sun at least 20 minutes a day. But I did a little bit more advanced technique, and that's what's shown in this picture. In the picture, he's looking up like this. He has his eyes closed, hands about 4 or 5 inches in front of his face, and doing the fingers up and down like this, and that creates a strobing effect with the light, so you're not getting as much ultraviolet light from the sun into the eyes themselves. And so you do that, and that strobe light effect, and you can go side to side as well, and people will think you're doing some weird little dance, or you're on like some weird drug or something. But so you do like that, and that helps to stimulate the cells as well. But I actually did it, and I'm sure I looked like I was completely insane. I did it with my eyes open, and so I'm looking right at the sun, and I'm just like this because it's so bright, and I'm just like that, and going, ah! And I wasn't making that noise, but, and I did it, and literally doing that allowed me to get rid of my glasses for 2.5 years. I mean, I was blown away. And that's why I said, okay, there's definitely something to this. I have to figure out a way to get this message out to more people to kind of explain how it works.
How many times did you do that? Just one time?
I did it that one time, just that one time. I know. I don't think I'm that special case or anything, because we've had several other patients that have had success with these exercises. And we're also going to talk about nutritional changes. So, legumes. Do you love those things? They're so good. They're so good. It's like lentils, chickpeas, that kind of stuff. They are so good for you, and it helps to slow down cataract formation. And so in countries that have diets really high in legumes, such as India, they eat a lot of lentils. There's such a low instance of cataracts that it's mind-blowing. But here, it's the #1 cause of blindness. So, and all cataracts is, and we'll talk about this in a minute, it's the protein in the lens of the eye starts to get calcified a little bit because poor circulation. And so there's a variety of ways to help prevent that. But legumes, keep in mind, legumes, very, very important for cataracts. Blueberries, these are my favorite, because they're just a super fruit, and you don't have to eat a certain amount. Just make sure you eat a consistent amount. So eat like a half a cup, a handful, whatever it is, every single day. And it actually has been shown to decrease the intraocular pressure in the eye itself, which can help to heal glaucoma, because glaucoma is a buildup of that pressure. So whenever you're at the optometrist, and I don't know if they do this anymore, would they blow the air in your eye? Remember how they used to do that? That was to see what the pressure was like in your eyeball, because if it's too much, it starts to pinch off that optic nerve that comes off the back of the eye and goes back to the visual cortex in the back. And that's the second, #2 cause of blindness is glaucoma. So that, I keep wanting to hit my computer, but my phone is so fancy, I'm going to put it right here. Peppers, macular degeneration. People are like, oh, I'm getting older, so I just can't see. It's age-related macular degeneration. Yeah. And the good thing with peppers is that it actually helps to increase circulation through the nitric oxide that it helps produce in the artery, so that increases the elasticity of the artery. And even if you have atherosclerosis, it actually can help reverse that process. And in the movie Forks Over Knives, I did a talk about that 2 or 3 years ago. Amazing movie, highly suggest you watch it, and it has really cool visuals on it. It shows how it actually can reverse the atherosclerosis and make the arteries nice and pliable again, and so that allows more oxygen or more blood, which leads to more oxygen, which that's going to make the macular area where you focus more healthy.
Are those hot ones, or you can use any pepper?
These are cayenne peppers here.
But is that what we have to eat?
No, just any kind of pepper, but the spicier the better if you can handle it. They have cayenne supplements as well. We have a cayenne supplement over there. I don't see it right there, but I know it's over there. The only trick is if you have a cayenne supplement, you really have to make sure you eat something right after you take it, or it will feel like you're on fire. It feels like it's burning a hole in your throat. I've tried that. It's not good.
Bell peppers are okay too?
Bell peppers are okay, but if you can do something a little spicier, that's usually better. Yeah. So a subluxation, as we all know as patients here in the office, I found the official definition. It is a spinal subluxation is when the vertebrae are misaligned with the other neighboring vertebrae, thus creating pressure on the spinal nerves. Now initially that's just a misalignment, and that's all it is, just a spinal misalignment, but when it starts to affect the organ systems, muscles, and other joints, that is when it becomes a subluxation. So that's when it's a problem. Okay? That's the clarification there. So I have a question here, and this is pretty common sense. If you have pressure on the nerves that go to the eyes, do you think that would affect your vision?
Yes.
Well, of course, I know, but I'm just trying to tie this all in, tying it all in. So now, this first case, now these are a variety of different studies that I found that actually are case studies that show that chiropractic adjustments have helped people get better vision.
Nice.
So the first one, oculomotor palsy. Now the oculomotor nerve is the third cranial nerve. It's the one that moves the eye, the extraocular muscles that changes the shape of the eyeball itself. It actually controls the eyelid as well. And when you have a palsy like that, you're not able to move your eyes in unison, so they can't work together. And so you have people that want to go one way, want to go the other way. You can get strabismus and nystagmus, where it just goes all over the place. That's not good. That's not good. And just in case you want to know exactly where it is, so now this is where the oculomotor nerve is. I know it's kind of hard to see. Oh, it's not that hard to see actually. So that's the third cranial nerve, and the optic nerve is even closer because that's the front there where the eyes are, and they cut this little section off right here. But right there, that's the optic nerve going up. So it goes up, goes to the eyeballs right there. So glaucoma, like I was saying before, if you have increased pressure, it pinches off that nerve, and that's going to affect vision, and second leading cause of blindness, which is bad. Oculomotor palsy, once again, they show that cervical adjustments, so in the upper cervical area especially, that has led to visual improvements because degenerative changes in the cervical spine have been shown and reported with people that have visual disorders. So there you go. So there's one. That was simple. This next one's really exciting actually. So has anyone ever heard of an Arnold-Chiari malformation? What that is when there is an issue in the brain stem. So this is obviously person facing this way, brain stem right here, cerebellum, brain up here, and the brain stem right here starts to sag down through the foramen magnum. So this is the skull, this gray area here, and it starts to sag down through the skull a little bit, and they start to have really odd symptoms. When I was in school, if there were all kinds of oddball symptoms, like they kept dropping keys and they like speech issues, things like that, and nobody could really figure out what it was, everybody always say, oh, it's an Arnold-Chiari. It's got to be Arnold-Chiari. And a lot of times it was kind of funny. But the scary thing is, in the medical community, what they do, this is another common sense. I know we all have common sense here, so it's not going to make sense to you. But they say, okay, well, if the pressure from the skull that's putting pressure here on the brainstem, because it's oozing, for lack of a better word, down too far, is affecting the function, then what we're going to do is we're going to make that hole bigger. And that'll take the pressure off. But what do you think happens? It starts to slide down even further. I mean, it's insane. So there's great studies on chiropractic and Arnold-Chiari, because a lot of people, we've had people actually ask us specifically, can you treat Arnold-Chiari? It's really scary because it's the brainstem and the neck and all that. It's just all fear-based. Yes, we absolutely can help people with Arnold-Chiari malformations, and I hope that person that asked that question is watching. So it has been known to cause developmental defects of the skull bones, which is the foramen magnum. It's about that. Oh, I'm going to walk around here. I apologize for not having so this is the front of the skull, this is the bottom of the skull, that's the foramen magnum. So they just go in there and the brain's coming down so it's like this, the brain's coming down too far, so they just cut that out even bigger. I still don't understand why they do that, but that's them.
The normal medical?
Yeah, the normal medical model, that's what they do. Evidence exists that supports the use of chiropractic care as a form of treatment for ACM, Arnold-Chiari malformations. Now, this specific case was a 20-year-old female, and she had an accident, a car accident, like 3 months earlier, and then 11 days previous to her visit, she reported that she couldn't see the faces of people. She couldn't process what people looked like, and it was freaking her out. She's like, what's going on? And so during her initial examination, she could only detect outlines of large objects and specific colors with her right eye, because her right eye was where she had some optic inflammation of the optic nerve, optic neuritis. That's another scary word for just nerve inflammation, neuritis. And if she had her left eye covered, she could not detect the presence of the eye chart. It's the Snellen eye chart. That's the big letter at the top, and then it gets smaller, smaller, smaller. So almost every angle of her gaze exhibited disorganization. So that's the oculomotor nerve that's affected, because the eyes are kind of going all over the place and kind of like a little seesaw effect with the pupils. So it's pretty common in the ACM cases. So she's obviously got a visual issue. So after each cranial correction, now whenever we get adjustments towards the end, we like to work on the coronal suture here and the sagittal suture. There's also an occipital suture right in the back, which my trusty little, it's right in this area here. And so we can feel if there's any misalignments there, and that's actually going to help work on the visual cortex, because that's right where the vision is processed. And so cranial adjustments like that have actually helped her vision. And her eye movements that were abnormal before were less saccadic, which is just moving in different directions. And there was less ocular confusion. So that's phenomenal. So went on and said that the cranial corrections were continued at the initial office visit until her eyes were moving through the cardinal fields of gaze smoothly and equally. Now the cardinal fields of gaze, that's when they hold the pen up like this and they say, okay, follow my pen, but don't move your head, and they move it side to side, up, down, and then diagonally. So that's to make sure that all your different fields of gaze are able to move smoothly. If it jerks around a little bit, that means you've got some pressure on those oculomotor nerves.
What causes ACM?
A lot of times they think it's just a birth defect. Sometimes it just causes it to sag down further. Sometimes it can be trauma. So it's kind of one or the other. So at the end of the first treatment, the patient noted that she could see the author's face through her right eye, which was shocking, and she could even see her mom's face, who was sitting 10 feet across the room. She was then taken to see the Snellen chart, the eye chart, and was able to read 20/30 with her right eye. And then after her second visit, 2 days later, she could see 20/20 out of that eye. So this is, I mean, it's insane. I mean, this is serious, like, brain injury stuff going on, and chiropractic, I'm telling you, it can help. So here we go, visual recovery following chiropractic intervention. This was a case study of an elderly man who fell down, head trauma when he fell between two logs and hit his head. Yeah, I don't know what he was drinking that day. But so he had problems when he woke up and he couldn't see. He's totally blind. And he had been diagnosed with cataracts, which is the #1 cause of blindness in America. And as we talked about before, the cataracts is the lens when the proteins start to get all kind of clumped up in there, and that's why the spicy foods and the peppers are really important for that, because it's going to help with the circulation and make sure you're getting all the fluids that you need to make sure that the circulation is in there, because you don't want anything dry. You don't want the macula drying up in the back of the eye where it focuses, and you don't want the lens to dry out either. So this individual, he diagnosed that he had mild macular degeneration, bilateral slight optic atrophy, so just a breakdown of the optic nerve, and he was unable to respond to traditional vision tests. So what I love about this, because even the optometrists know, he was referred to a chiropractor, because he's like, you know, I don't think I can help him. We need to get some pressure off those nerves and help him to see better. And so this is my interpretation of what he probably looked like. Except he would have two big logs on either side of his head. But that would be bad. So following chiropractic treatment, he reported that he had vision improvement and began following after his third adjustment. He reported that he was able to read better, et cetera, et cetera, et cetera. Following the improvements, the patient began to distinctly see actual light coming through a window. So instead of just black and then blue swirly lights and then yellow, he actually could see light coming through the window. So he was totally blind, and then after 3 adjustments, he was able to see again. So by eliminating the interventional intervention, aka nerve pressure, caused by the cervical soft tissue trauma to the head, so the inflammation had put pressure on those nerves. The optic nerve blood supply could have returned to normal after its previous constriction caused by the head trauma. So all you have to do is eliminate the nerve pressure, aka with a chiropractic adjustment, and there you go. Now this is an individual that received an upper cervical specific chiropractic adjustment, and when we do that, that's when we do the toggle recoil when you're on your side and the headpiece drops down. That's focusing on the top bone in the neck. So this was a study done on 67 subjects who had not previously ever gone to a chiropractor. They ranged in age from 9 to 79 years, averaging 46.4 years. They were evaluated for each eye before and 6 weeks after receiving the chiropractic care relative to their ability to accurately identify letters in a standard Snellen chart. That's the eye chart again. Sorry there's so many words on these slides, but it's just research stuff. The study suggests that upper cervical specific at C1 or C2 chiropractic care caused a differential improvement in the visual acuity of both eyes, as measured as a percentage change in vision acuity before and 6 weeks after chiropractic care. Through upper cervical chiropractic adjustment procedures employed within the current study, vision acuity improvements appear to be linked to the correction of vertebral subluxation. I couldn't even believe they used that in a research, that word. That's amazing. And chiropractic methods of upper cervical specific care. So, I mean, we're making progress because they're doing the research and we're finding out exactly what's causing the issues, and it's the subluxation, but they don't want to talk about it because it's the secret chiropractic word. But it's pressure on the nervous system that's killing people, and we got to really correct that. So it's like the secret handshake, secret word. So vision, the cervical spine, and chiropractic. So now this one makes important note that though chiropractic is not a treatment for esophoria, which is a condition where you have one eye that goes in, but it's not cross-eyed, it's not diplopia, or it's not seeing double, but one eye goes in because of an extraocular muscle imbalance, or blindness, or scotoma. This is a really cool, scotoma is when you're looking, everything looks normal, and there'll be like one little section of where you're seeing, of your visual field, that looks like it's all moving and like funky looking. So it's like a circus mirror, but just in one little section. So that's a scotoma. The correction of vertebral subluxation provides patients with benefits such as visual improvements that are not directly linked with their musculoskeletal complaints. So we're not just low back doctors, we already know that here in this office, but we can help in a variety of ways. Ultimately, even non-specific chiropractic interventions have the potential to bring about favorable results with regards to visual issues. Now this next one is my favorite. 114 cases, 83% of them saw improvement after a chiropractic adjustment. So we're getting into some bigger numbers now. Out of the 54 of the cases that the researchers followed up on for a minimum of 6 months, 95% of those still had that correction in their visual issues because of the chiropractic adjustments. And
adjustment?
No, it's a series of adjustments. So also contained within this report were cases of vision that was returned to blind eyes, like the guy before that got hit in the head. So I'm not saying that we cure blindness. All I'm saying is that chiropractic adjustments take the pressure off the nerves and allow the body to do what it's supposed to do and to heal itself. So vision is your neurological window. Now this article briefly discussed that the spinal nerves play a very important role in vision because the nerves from the cervical spine, which is in the neck obviously, and upper thoracic spine in the upper back help to dilate, widen the pupil, and the opening, which is the opening that allows light in to the eye. These spinal nerves also make distance vision possible by helping change the shape of the lens, because if you're looking up close, the lens has to be a certain thickness, and then when you're looking away, it has to, the little ciliary muscles that are controlled by that optic nerve that go there, or actually no, that's the oculomotor nerve, they have to be able to change the tension on the lens to change the thickness to be able to focus in the distance. And so this is talking about how that's really important, and you have to control the blood vessels that supply the brain and the eyes as well. Chiropractic treatment, when it focuses on correcting misalignments or fixations, which is a subluxation, in the upper thoracic spine and cervical spine, which can disturb the same spine nerves that affect vision. It argues that chiropractic adjustments to correct subluxations can help alleviate the related visual disturbances, which makes sense. It's reported that even some people with 20/20 vision at their first visit can get even better vision after 2 weeks of chiropractic care. So even if you don't have a vision problem, necessarily, you see fine, people start noticing. We have people that have noticed vision changes. We also have people that have noticed that they've gotten their sense of smell back and they didn't realize they'd lost their sense of smell. Hopefully it wasn't because it was a bad smell, but they're actually able to smell better, which is just amazing. And it all makes sense when you see how we process vision. So the image comes in through the iris, hits the back of the eye on the retina, at the fovea centralis in the macular area. The optic nerve takes the image, takes it back to the visual cortex. Now obviously this isn't to scale because this would be way bigger, but it's just trying to focus on the eyeball right there. So like I said before, the visual cortex is in the back, and that's where, kind of like a camera, it processes the image and tells you what it is. So instead of just seeing a bunch of stuff, it like processes and tell you, okay, that's a dog, that's a little chihuahua named Peanut, or it's a palm tree or something like that. So it's all processed in the back of the brain, and so that's what we are. We're nervous system doctors. We work on the spinal cord and the brain itself when we do that cranial work, and that's what's so important here because it helps so much. So I have another question. We already know that. Now what does chiropractic do again?
Everything.
It removes the pressure on the spinal nerve. So it's obvious the connection between chiropractic and improving vision because it takes the pressure off the nerves that do the processing of the vision, and it's just, we're an office full of common sense people. That's just how it is. Now if you want to get even more studies, you can get the book here. It's on Amazon.com, and we also used to have copies here in the office. I don't know if we do still or not. Are there some there? Okay. And I've also, because like I said, I've started this a long time ago and I've really tried to put all this into an easy to understand format. There's 3 books, but I'm also in the process of coming up with the Clear Vision Construct is what I'm calling it. And that's going to be coming out hopefully next month. And it comes with all this different stuff. You got all 3 books. I'm working on the formulation for a supplement to make sure you get all the nutrients that you need to make sure you have the best vision ever. It's going to have video trainings. You'll also, the first 1,000 people to sign up, get a free download of the You Don't Need Your Glasses book. So that'll be, you can get access to it immediately. And that's going to be at relaxedtoclarity.com is the name of the website. And it's not available yet, but you can go there and add your email in and I'll notify you when it's all ready. Plus the good thing is it's going to be a membership site, and members get a discount of up to 25% on everything on the site.